Difference in oral and topical minoxidil lotion. Who are the ideal patients who should take oral minoxidil? What are the side effects of oral and topical minoxidil? Is oral minoxidil tablet really better than the topical lotion of the minoxidil? You have this confusion about oral or topical minoxidil and are confused which one you should be taking, then this video is ideally made out for you. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and a member of American Board of Hair Restoration Surgery and a member of International Society of Hair Restoration Surgery in the field of hair loss and hair transplant since 2006, and also training doctors in the field of hair transplant since 2016. If you have these queries and want an answer to these queries, please keep on watching this video till the end, because there are many useful points we will be covering in this video. We would also like you to subscribe to our channel so that you can keep on watching such useful videos about hair loss and hair transplant. So let us first jump into and know more about oral minoxidil. It comes in a tablet form and there are various strengths or doses of oral minoxidil available in the market, like 2.5 milligram or 5 milligram or even higher, which can be used by a combination of the lower doses tablets. And basically this oral minoxidil needs you to have a prescription of the doctor. It's not a OTC or over-the-counter product which you can just go and buy at a pharmacy. You need to have a prescription for this oral minoxidil. Also, it is not US FDA approved. Oral minoxidil is not US FDA approved for the hair loss as a hair loss treatment. Whereas the topical minoxidil comes typically as a lotion in various percentages like 3%, 5%, 10% or even 12%. This is a product which you can buy online or you can go to a pharmacy and buy it without a need of a prescription of a doctor, and you can start applying it as per your own knowledge also. But it's always better to ask about this product also from your treating doctor, so that they can also guide you if there are unwanted side effects of the topical minoxidil, and they can steer you either to increasing the dose if it's not working or to shifting you from topical to the oral form. This topical minoxidil solution is basically approved by FDA as a hair loss solution for more than 30 years. Both oral and topical minoxidil, the basic compound is minoxidil, which was an anti-hypertensive agent, which means it was initially used to control the blood pressure in the 70s and 80s, and then some side effects were noticed by the treating doctors and they found out that there were unwanted growth of hairs on the body when these tablets of minoxidil were used to control the blood pressure. And that's how the idea came to the mind of various doctors that this can actually be used to improve the hair loss solution and to improve the condition of the scalp and to regrow some of the hairs which you have lost. Please like the video if you are liking the content till now. Now let us discuss whether the oral tablet minoxidil is really better than the minoxidil lotion. So a study was conducted in the year 2021 from January to December in the country of Brazil. The effect of oral and topical was studied on 90 patients. Data was analyzed for another 1 year, and this article was published in a journal in April 2024. 90 patients were divided into two groups of people who were using oral and tablet form of minoxidil, and they were studied for a very long time, and then the efficacy of both oral and minoxidil was checked. So surprisingly, it was found that the efficacy or the results of oral as well as the lotion minoxidil were same. So this misconception that oral is somehow better than lotion is not true, and this has been proved in this study which was published few months back. So please friends, beware of and be cautious about this fact, because sometimes you may be misguided into thinking that somehow the oral form is better. If you are planning a hair transplant for yourself or your family member or your friends, anybody, please write down in the comment section below and then we will try to reach out to you. Also, if you have any queries about minoxidil per se, you can again mention that in the comment section below. Now let us discuss the side effects of both lotion or topical minoxidil and the oral minoxidil. So as we all know that topical solution of minoxidil can cause most commonly irritation of the scalp, dandruff formation and some flakiness as well as some irritation, which is quite common with the lotion of minoxidil. Regarding the side effects of tablet or oral minoxidil, a study was conducted on more than 1,400 patients and they found found out that the most common side effect in 15% or slightly more than that was hypertrichosis, which means that the hairs were growing all over the body because of the minoxidil, and this led to discontinuation. They had to leave using this drug, the oral minoxidil, because of this side effect, and it was slightly more in the female patients who were using oral tablets of minoxidil. Apart from this, some other side effects which were found were lightheadedness. Patient used to feel giddy or lightheadedness. Their heart rate was higher. They had swelling around their ankles. They had swelling around their eyes. In some patients, there was insomnia, lack of sleep. They could not sleep, and very, very rarely there was a fluid collection around the heart, and this gave rise to a dangerous side effect known as congestive heart failure, where the heart could not pump the proper amount of blood into the entire body, and this led to the congestion of fluid into the heart. Recently, we had 2 such patients, and they showed their previous pictures. They were using oral minoxidil, and one of them had dilatation of the veins on the neck, severe dilatation. They were quite dilated, and they showed the pictures and videos, and it could be seen that this dilatation of the veins was something very, very abnormal. So if you are taking oral minoxidil after getting a prescription from your doctor, you should be always cautious that if you feel that there is some increased swelling around your ankles or your veins are getting dilated, please do consult the doctor, discontinue the medicine, and if possible, be very cautious about this. And if it is quite severe or extreme, you may have to take emergency health care also. Friends, please be cautious about these side effects of the oral minoxidil before actually starting that. If you want to connect with us regarding your hair loss problem, and if you want us to guide you about your hair loss and hair transplant, please call us at the numbers given on the screen here. So who should be taking oral minoxidil tablets? In our practice, we start with the topical or the lotion form of minoxidil. Typically, we start at around 5% minoxidil, 1 ml twice daily, and we ask the patients to connect back to us within some time, like 1 or 2 months, if they are having some side effects like scalp irritation, dryness. Initially, we try to switch them to the non-alcoholic or the minoxidil foam solution, but if that is also not working out for you, then you can shift to oral minoxidil tablets. We start with a lower dose of 2.5 milligram once a day, and then gradually increase the dose if it is not working for you. And at the same time, we keep on asking or taking a feedback from our patients whether they are having any of the side effects which we have just discussed. If you want to know more about minoxidil solution in detail, you can click on the video link given above, where we have discussed about minoxidil in great detail in a separate video also. Do share this video with your near and dear ones, or your friends or your family members who are looking out for a genuine, authentic information about minoxidil. If you want to watch one of our recent hair transplant videos and the results of such patients, you can click the video on the left. And if you want to know more about hair loss solution and home care tips to prevent further hair fall, you can click the video on the right.